folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our opinion, of course,
We're going
Bob.
to show you some shoulder stretches today, but the thing I want you to keep in mind is that you're not going to be doing all these at once.
Right.
You pick one or two, you work on it. As your shoulder pain goes down, as your shoulder range of motion improves, then you can go on to the next one.
Right, right.
And also, it's very important. So we're going to have you do these exercises probably 4 to 6 times a day. I mean, not just once a day.
Right.
And that's why we only have you do 1 or 2 because you don't have time.
And so you do the ones along with us. If it irritates your shoulder, feels like it's not doing any good, you can scratch that one. It may be
Right.
too early for it, or it may not be one for your problem.
Try a different one. But
Yep.
the other thing I want you to keep in mind is that you really want to have good posture while you're doing this. And we're going to show you a little reason why. Brad, if you want to do it seated, I'll do it standing. So if I got poor posture and I raise my arm up, that's as far as it goes. Now, as I straighten up, now, look at that baby.
Yeah.
Goes all the way up.
Yeah. It's all in the
So-
mechanics of that shoulder.
And the
posture.
shoulder blade.
Yes.
So
Yep.
let's go ahead and start with the first one, Brad. So the first one is a shoulder extension. This is according to Robin McKenzie.
Yep.
He likes this one. So we're going to take a stick. You could use a broomstick or a dowel or PVC piping or
whatever you can
a
do.
booyah stick.
4 or 5 feet long. Something.
Right.
Make
So-
sure it doesn't slip on the floor.
I'm working on the left shoulder.
Okay.
So I'm grabbing on, palm facing me, palm away on this one. And I'm just, what do you call this, paddling?
Yeah, canoe paddling. So this is the shoulder we're stretching right here.
Right. I want to keep good posture. I don't want to bend over like this.
Exactly.
And I want to go as far as it is comfortable.
Right.
If it starts to hurt, back off and go back down again. But eventually, over time, we want to go further and further.
Right. I do this one regularly. This is this is in my routine. It feels good. I feel like when I'm done, my shoulders loosened up. It's better, and those are the results you're looking for.
Yeah.
It's quick. I can do that in
You
minutes.
possibly could do it with your hands too. You could just put your hands behind you and go like this.
Yeah.
This is one thing that it's recommended. In fact, like if you've been doing a lot of overhead work,
Yeah,
you
sure.
would stop and go ahead and do a couple
Yeah.
of these.
If you can't reach your hands behind your back, just
good point.
I use a towel, and it makes it much more comfortable for
Yeah.
me. My shoulders are tight in that direction.
So next one, we're going to do shoulder internal rotation. Now you can do this also with the booyah stick or a broomstick, but you can also do it with a belt.
Oh,
I'll show it first with the stick, Brad.
yeah.
So
A cane works too.
Yep. So I'm going to go ahead and get this position right here. This palm is facing out. This is the painful shoulder.
Right there.
Now, quite often you'll find out that the painful shoulder has a lack of motion. So if I try to go up as far as I can only go this far, but this one goes way up here.
All right, there's about 3 or 4 inches difference. This is the tight shoulder, and oftentimes the painful shoulder.
So we're going to want to try to equalize it. So again, palm out on the painful one,
Right here.
palm toward me on the upper one, and we're going to work on sliding up. Very simple. Again, in a pain-free range, maybe bump up against the pain
Right.
at the most.
Pain-free, got to emphasize that.
But eventually, you get it all the way up to, I'm going to run to the ceiling here, Brad. Eventually, you get it all the way up to where the other one is located.
I'm
So-
going to show you.
Brad, yeah, why don't you show it?
You could just use a belt. A smooth belt works much better because of it's going to slide on
Because
your
you're a smooth
clothing.
guy, right?
Yeah, I'm smooth. So I'm going to take this. I'm going to go like this around my wrist, and this is the hardest part about it is to get it arranged.
Yeah, get in position.
And then I just simply do this, and this is where the slippery belt going across the clothing on my shoulders, frictionless. And then I just stretch and go back down. You know, this is the way that when I first learned this is how I taught all my patients. And then we caught on with the
Oh,
stick.
really?
The stick, I think, is a little easier, but this still works too.
We give you a lot of alternatives.
I had one woman scheduled for surgery. She did this exercise, and this was the not the only exercise, but the key exercise, which I think eliminated the need for surgery.
Yeah, these exercises seem really simple, but it's amazing the outcome they can have. I mean, next one, Brad. I need the plinth here.
Oh, sure. So this is something that could be done on the bed or on the floor.
Yep, exactly.
Both of them, either. Doesn't
Either
matter.
one.
Either one.
So very simple. We like you laying flat on your back because it gets your shoulder blades in the right position. But I'm going to work on this arm right here. And the best way is just to grab on with the other arm and pull it up overhead like this. And you're working on making sure those shoulder blades are kicking in to keep it in alignment.
Yeah. I can see your shoulder blade right here. It's hard. You probably can't see it there, but it's moving out. So we're working the shoulder blade, the shoulder, elbows stay straight. So we're not flexing the arms.
Yep.
Straight arms, and all the motion comes from the
You
shoulders.
could use a towel. I don't know where a towel
Here,
is.
just use this one.
Right here.
Use that one.
Make a big mess.
Just drop it, Bob. It doesn't matter.
Okay.
Mike will pick it up.
You go a little further apart, or you can lead with the other one
Sure.
like this.
So he's pulling with
Yep.
the left arm.
And you could use the booty stick too. You could hit me.
There we go. We do it here. So
And eventually, well, not at this time, but you could add some weight later on.
sure, right.
All right, Brad, what do we got next?
It usually 10 repetitions is all you would want to do on these.
Do you want to show scrubbing the wall?
Yes. I'm going to scrub the wall. Even if it's not dirty, you can still scrub. So,
Wax on, wax off.
yeah. So use the wall simply to eliminate friction so you can slide. And we'll do it there on this shoulder.
And sometimes they do it a little bit off to the side, Brad.
Yep. Little.
No, I mean, a little.
Give me that. This is off to the side abduction.
I mean, like this.
Oh, I see what you're saying.
More like this.
Yeah.
Instead of straight in front of you. They go this way.
I think whichever way allows more pain
A
for your
little bit
range
of
of
both
motion.
I would do. It was going to help.
Yep.
So
Yep.
next one is Statue of Liberty with the booyah stick, Brad. Do you want
Oh,
to show that?
sure. I love that one.
And we call it progress Statue of Liberty because you can actually progress your flexion.
So this is a shoulder. We want to stretch this way so we can reach higher. Grab a stick. You need to make sure it doesn't slip on the floor. If it's on carpet, it's fine. Otherwise, you need a rubber end. Grab at any point where you feel comfortable, and then you simply lean forward, and it's going to stretch that. You get a lot of leverage this way and a lot of control. So between the two, it works out for a great
We
stretch.
have a lot of patients who really like this one. Really good for arthritis if it's a lack of motion, but they're really proud when they come back, Brad, because the first time they're maybe going like this, and then they come back and they're way up here,
Sure.
and their arm, they can see it. Their arm has gone better.
Yeah,
They're
you can
able to
reach into the
stretch.
cupboard now where they couldn't before.
Their pain maybe has gone down.
Just
So-
be careful. Don't get aggressive. If it creates pain or sharp pain, you're going too far. You have to slow down. This may take days or a couple weeks to gain range.
Now we're going to show you an advanced one, and the reason I'm going to show you this is because it helped me, it helped you,
Sure.
and it helped my wife. So I think it's worth showing.
Which one? Is
The
this
chicken wing.
That's what I was
Yeah.
thinking you were going to do.
But I don't want you to do this one if you have loose shoulders or your shoulders tend to dislocate. you know, if you have lax shoulders. Probably if you have severe osteoporosis. I don't want you to do it either.
Right.
So very simple. Not very simple, actually. This was a little more complicated. But you're getting the same position that you did for the internal rotation. So this is the painful arm. And palm out, and this is the palm in or facing away. And you're going to go ahead and you're going to work on, now I don't want you bending your body,
Right.
you're just bending the arm. So you're working on bringing the arm out and up. So it goes up and out. Up and out.
And make sure you pull the
Yeah.
stick on the side of your
Right,
head.
don't hit your head.
Ah.
That's probably not a good thing to do.
Again, you're not going to do this if it creates pain in your shoulder. If it's just a gentle stretch pain, that may be okay, but use caution, use good judgment. We don't want to irritate the shoulder. We want to stretch it. It should feel good when you're done.
Yeah, surprisingly enough, for us, it's really helped with impingement.
Yep.
If you ever had trouble with your shoulder, where you get that pain, where you go halfway up, and it hurts, and maybe as you go further up, it stops hurting.
Right. Actually, with all these exercises, you can measure your range of motion and do the exercise, and if it goes up higher and feels better, you know you're right on the money with that particular
We
exercise.
are going to mention shoulder hanging too. This is we were first introduced to this by Dr. Kirsch. He wrote a book on it, and simple is all you need is a pull-up bar or something to hang on, a tree branch. We got the hanging handles. These can attach into any stud. You got to have them attached to a stud to make sure you're not going to pull it out of the wall. But these work very well. Brad, you want to take it from here?
Sure. And we advise doing this with your back to the wall. You can do it this way, and I guess if it feels better hanging towards the wall, it might be okay. But the nice thing about the wall is it really promotes good posture, and you can use the wall to help yourself gently slide into the hanging stretch. Don't get too aggressive. When you start, you may only put 50% of your body weight through it, and then it's okay. It will create a little bit of pain. It may only start with 10 seconds when you start,
Right.
and you're going to work up. I hang about 30 seconds. I know in the book he talks about longer, people going 1 or 2 minutes. If you get good results and you get done hanging and things feel good, that's okay.
I saw in a lot of the testimonials, though, a lot of people were doing less. I mean, they were doing it for 10 seconds or 15 seconds, and they had good results.
You get a feel for it. As long as it feels good, and when you're done, you feel like you've loosened up and there's no pain, it's a good thing.
You had a lot of testimonials that from people that said they were scheduled for surgery, have a rotator cuff repair, and they never had it done because the pain went away.
Yeah.
So, again, some things for you to consider. Again, you're not going to do all these at the same time.
Exactly.
Just do one. And remember, Brad and I can fix just about anything
Except for
a broken heart.
right.
But
This has got not well. Yeah, Bob. I worked on it last night a little bit.
Did not.
Well, I thought about it.
All right. Thanks so much.